So basically this wrap-up really is to say, well, what's next? So in your packages that were given out at the beginning of the day, I think we've walked through the driver diagram template and example, but also you'll have this overview of the collaborative, which runs us basically through the 6-month co-design phase, and then the 9-month quality improvement. And in that, we've also built in some Zoom session tutorials, which is what Natalie mentioned previously. So I think on the sheet called, and actually just to say another thing, also in your pack there's this safety cross, which you might wonder what on earth is that. That was just, it's just a very quick, if you're wondering about how we're going to be collecting all this data, just a very quick tool for data collection, so you can use it. I think the zero seclusion team, some of them are using this, and how might that relate to any data collection. So if you have a failed transition or whatever data you're collecting, you can just put a cross on the, so it's meant to be 1 month per cross, and just be a quick, easy way for units or wards to collect data, but that's what that's doing in there. But on the, and then there's the PDSA form you can use for your small tests of change, just to document your plan, do, study, act cycles. And the really important part of that, as I'm sure you're all aware, is the prediction. So you might plan to test a new transition plan on a consumer. What's your prediction that will improve their understanding of when their next appointment is, or whatever it is? And so your prediction is either proved or not proved. And that's the whole point of this whole study act cycle. But what I'm getting around to saying is on the DHB improvement team task tracking tool, this really is sort of giving you the steps through in the processes that you should be working through, leading up to when we next meet again for the learning session 2 in August. So that runs through, if you haven't already, I'll just talk, actually it's not here. It runs through identifying your project team, and I think that's what is missing from that, and actually we'll add it in, is Maori health representation. Then it's looking at your charter, looking at your driver diagram, thinking about your measures, including process, outcome and balancing, and then starting to think about what are your small tests of change that you're going to start working on. And then you can, if you want to, there's also a scoring sheet. So just if you're interested to know how do you think your team's doing on where you're at, there's this project progress assessment scale. So you can just use that yourselves just to see, okay, how are we doing with our project team? Has our project been identified? Have we got a planning in place, or are we having regular meetings? Is there activity but no change? Have we started to test some changes? And then you can then you can just give it a score. So that's just a useful thing for you maybe to do with your team to see where you think you're at. So yes, so what we're going to be, the teams will be working on then between now and August is, as I said, getting your aim identified, and that's probably the first thing is trying to identify your aim. I think we're having some discussions at the table. Was it an aim, or were things drivers? So yes, it's just getting that. What is the problem actually you're trying to address, and what is your aim to improve it? So that's about your theory for improvement. Working on your driver diagram, thinking about your measures, testing change ideas, and then and as I've stressed before, is linking those change ideas to your aim. Because if they're nothing to do with your aim, then you're, I don't want to say wasting your time, but you are a little bit wasting your time, because actually it won't impact on your aim. So what we've done to support you is to build these Zoom coaching sessions in. So I think the zero seclusion teams have found these really helpful. They are totally optional. We do them via Zoom. You can have as many of your team sitting around together, or however you want to zoom in for those. So we can, if you think one is more pressing than the other, we can change the focus. But this is the order that Zero Seclusion did. So a driver diagram tutorial coming up in May at 11:30 to 12:30. So those dates I've put on the bottom of that, the tracker tool, so you can see them on that as well. And that's just so we'll have somebody there doing some coaching. How are you getting on? So don't be scared of, sometimes people are scared to speak up on Zoom, but we're there to help you through this. And I can guarantee that if you ask a question, somebody else will have been wanting to ask it. So don't be shy. You can put things through in the chat box, typing, or you can ask, and then we'll have the teams there for helping you with that. And then the following month, looking at data collection. So I think that's what you were talking about, Natalie, with that one around measures or data collection. And then the 10th of July on PDSAs. But if you find that there's a really pressing need, a topic that we haven't covered in that, please let me know, because if there's interest, we can try and put another one on. So that's leading up to our learning session where we'll meet again in August. We have selected Dunedin for the South Island meeting for the South Island group as a request, but I think that probably hasn't really worked well as a venue. I think it's proved quite tricky for people to get to, so we probably won't do Dunedin again, but maybe the South, we've put Wellington, so we're sharing things about, so Auckland and Wellington in August, and then Wellington, we probably won't have the regional split for our final get-together learning session 3 on the 4th of December in Wellington. So you've got some resources in your pack. So I mentioned the PDSA worksheet. Also, I just included for your reference, really, if you'd like to use it, and I'll send all this by soft copy, is the monthly update. So that was what really for you to use as your reporting up mechanism. So how are you thinking about your team? So how are you reporting up to either your senior executive team or your clinical governance? So I think for you, thinking how are we getting visibility of this work within our DHB? So teams have found this really useful, just as a one-pager that you can either go and present at your clinical governance group or submit in for their papers, so that they're hearing what are your successes, what are your challenges, and how can they help you with your challenges and around any support that's required. Because I think what I mentioned before, the sponsor role is really key, because sometimes you can just feel like you're struggling a bit alone and nobody knows what you're doing or what's happening. So this is a way for you to, and sometimes you sort of have to push the door a bit to push your way into getting your place at the table, in terms of, because this project's, I think we're all here because this piece of work's really important, and we want others to hear how important this is, and this is what we're doing about it to try and address it. So I think Kevin said this before, there's no shame in failing, and there's no perfect PDSA, no perfect time, and possibly you learn more from when things don't work as when they do. So this is just a quote from Thomas Edison: "I did not fail 1,000 times, I found 1,000 ways how not to make a light bulb." So one final thing then before we ask to come and close our meeting is, in your pack you'll have an evaluation form that you started this morning about what does a good consumer experience transition looks like. So maybe if you could just take a couple of minutes just in terms of what you think worked well today, what could be improved, because we do pay attention to those. We do a PDSA, like we planned a learning session in Dunedin based on the feedback. So yes, we're all doing PDSAs as a project team. So yes, if you could please do those for a couple of minutes, just leave them on your table, and then I'll ask to come and close our meeting. Thank you very much.